So chronic inflammation may develop following an acute episode of inflammation if the cause is not completely resolved. So that flow chart that we looked at, where acute inflammation, if the cause persists, it can develop into chronic inflammation, or inflammation may develop owing to chronic irritation, such as smoking. That's chronic irritation, certain bacteria, or long-term abnormal immune responses, particularly autoimmune responses. So chronic inflammation usually is following an acute episode of inflammation. There is less swelling and exudate, but the presence of more lymphocytes, macrophages, and fibroblasts. So fibroblasts are connective tissue cells, which are building up scar tissue. They're shooting out collagen. Frequently, more tissue destruction occurs with chronic inflammation. So there's more collagen that's produced in the area, which results in more fibrous scar tissue forming. There's a balance between scar tissue and healing, and we'll talk more about that. We'll talk more about tissue healing in a little bit, and about that balance. You can develop a granuloma. Oma usually means tumor. So granuloma is a small mass of cells with a necrotic center that's covered by connective tissue. It may develop around a foreign object, such as a splinter, or as part of an immune response in some infections, such as tuberculosis. So tuberculosis, the chronic infection, the bacteria in its latent state gets surrounded with connective tissue, and it's just sitting there like in a little cocoon. So there are definitely some potential complications with chronic inflammation. You might get, there are some autoimmune disorders, such as rheumatoid arthritis, which have chronic inflammation with periodic exacerbations of acute inflammation. So a lot of times when you talk to people who have RA, when they're having an acute exacerbation, they'll say they're in a flare, they're having an RA flare. Deep ulcers may result from severe or prolonged inflammation, because cell necrosis and lack of cell regeneration cause erosion of the tissue. So this in turn can lead to complications such as perforation, which is erosion through a wall of viscera, or the development of extensive scar tissue. So chronic inflammation can be a big problem, and it can cause other problems in its wake. So we want to try to avoid chronic inflammation by addressing acute inflammation in its early stages. So in the next section, we're going to talk about treatment of inflammation.